There is an awkward little health problem that many people experience, but very few people want to talk about it clearly. I'm talking about those annoying abrasions, irritation, or tiny tears around the anus, often after hard stools. Sometimes there is stinging, it makes you hesitate before the next bowel motion. Sometimes people begin to strain in a strange way because they're trying to avoid pain. And once that cycle begins, that same area can keep getting irritated and abraded all the time, again and again. Most standard medical advice says keep the area clean, avoid straining, use fiber, soften your stool, or take a warm bath. That advice is sensible, important, and necessary, but incomplete. It misses one small step. If the stool is hard, yes, you need to soften it. If you're straining, you still need to reduce straining. If there is persistent bleeding, worsening pain, a lump, pus, fever, mixed blood through the stool, bowel habit change, unexplained weight loss, or anything concerning, you still need to see your doctor. This video is not about ignoring serious disease. It is about one practical missing step in a very common everyday problem. The missing step is what I like to call glide or friction, contact control. When the skin at the anus is already raw, cracked, or excoriated, the next bowel motion can scrape the same surface again. Toilet paper wiping can also graze the thin anal skin and mucosa. That scraping and rubbing can lead to more stinging, more pain, more hesitation, more straining, more hemorrhoid irritation, more tiny tears, and more discomfort. So the problem is not only stool hardness, it is also the damaged exit being rubbed again and again. That is why just keeping it clean is not enough. Clean skin can still be unprotected skin, where it is superficially breached. If you use a bidet water wash, the area may be cleaner, but it still needs to dry. Then people wipe, pat, or blow to dry. But too much washing, wiping, drying, and rubbing can still dry the skin and mucosa. So yes, water cleansing may be kinder than dry toilet paper, but water alone does not provide protection. One more awkward practical point belongs here. Lubricated wipes. They can be useful, but do not flush them. Even when the packet says flushable, many wipes do not break down like toilet paper and can block pipes. If you use them, bin them. The area needs to be clean, gently dried, and protected. The awkward missing step doctors often do not mention is friction control. If the skin around the anus is already sore, cracked, rubbed, or irritated, the next bowel motion can scrape the same damaged surface again. Then the person gets more discomfort, more hesitation, and more straining. That straining can worsen hemorrhoids, aggravate small tears, and keep the cycle going. Most advice says use fiber, drink water, avoid straining, keep the area clean, use warm baths if needed. That advice is sensible, but that usual advice is necessary but not complete. The practical missing layer is barrier plus glide. Petroleum jelly is the simple version. It gives basic barrier, reduced friction, but putting it on just before a bowel motion can be too late or too inconvenient. You could be at work. You could be in a public toilet. You need to go. You are not going to start a whole preparation ritual. My own approach is to put the ointment where the routine already exists, in the shower area. So after shower cleansing with water, when the area is already clean, I gently apply a small amount of bland barrier ointment around the anal opening. If the irritation is right at the entrance, I may apply it slightly inside the entrance as well. I prefer a ceramide containing barrier ointment with dimethicone or silicone. Petrolatum gives barrier, dimethicone or silicone gives smoother glide and water resistance, and ceramide adds barrier support because ceramides are part of the skin's own barrier. That is not magic. It is not a substitute for seeing a doctor when symptoms are persistent or worrying. But for everyday irritation, abrasions, or discomfort after hard stools, this small, awkward step can make a real difference. That is the practical point I want to emphasize. Before a bowel motion is often too late. In theory, applying petroleum jelly before going to the toilet makes sense. In real life, it can be inconvenient. You may be at work, you may be out, you may need to go. People need a routine that works before the problem happens. That is why my own personal practice is to place the ointment in the shower. After shower cleansing, the area is clean. Then I gently apply the protective layer. I'm not presenting this as a miracle treatment, and I'm not telling people to ignore persistent symptoms, but as a practical habit, it has helped me a lot. Petroleum jelly is the basic version. It is cheap, bland, and useful. But some people find it sticky or less smooth. A barrier ointment with dimethicone or silicone may feel smoother. It gives more glide. It may reduce that dragging, rubbing feeling on raw skin. If the ointment also contains ceramide, that adds another useful idea. Ceramides are not magic. Ceramides are natural barrier lipids already found in the skin. They are part of the skin's own protective barrier. So with a ceramide containing ointment, the goal is not just coating the area. The goal is to add natural barrier support as well as friction reduction. That is why I like the phrase barrier plus glide. Petrolatum gives barrier. Dimethicone or silicone gives the smooth glide. Ceramide tops up our natural barrier lipids. So the simple routine is this. Soften stool, avoid straining, do not sit forever on the toilet. Clean gently, dry gently, protect the area with a bland barrier ointment as part of a routine you can actually follow. This is not glamorous advice, it is not dramatic, but sometimes the most useful health advice is a small practical step that nobody explains properly because it is awkward. And if you value calm, no hype health information that speaks about real problems directly, subscribe to Dr. Chris Ho No Hype Health Talk.